A medical examiner confirmed today Olympic gold medalist Tori Bowie died from childbirth complications. The track star was found dead in her Florida home last month. She was 32. Bowie won silver in the 100 and bronze in the 200 at the 2016 Rio Olympics. She then ran the anchor leg on the 4x100 team to take gold. And a year later, she won the 100 meters at the 2017 World Championships in London and helped the 4x100 team to gold. The medical examiner says Bowie was 8 months pregnant and might have gone into respiratory distress and eclampsia. This is a condition related to preeclampsia that causes seizures during pregnancy. Only 3% of people are affected by both. A survey for the March of Dimes finds only 42% of people are really familiar with preeclampsia.
Blood pressure will start to rise. Dizziness, blurred vision is very common. Nausea and vomiting, abdominal pain, and then a lot of swelling.
Ended up vomiting controllably, couldn't stand, severe swelling in my feet and ankles. I called him back again. He said, you probably should go to the nearest ER.
The most important thing health experts are stressing is to talk to your doctor about any symptoms. Nothing, they say, is too small. Having those conversations can help catch any complications early and make sure that mom and baby have the best experience possible. Now, one group has seen and experienced disparities in medical care with minorities. Elsie Preston has more on a service that provides Black women with a doula to guide them through the birthing process.
Breathe in, 2, 3.
Carrie Bernuns is counting down to when she and her partner Jeremy welcome their first child, a baby boy. The healthy, expectant mother feared she would have to deliver at just 24 weeks. After having some early contractions, she says doctors misdiagnosed her with an open cervix.
That was just unnecessary, and it was just hard.
Bernuns, who felt her concerns over medications she was prescribed were being ignored, switched doctors and got a doula through Frontline Doulas, a community program that provides free access to care for Black mothers in Los Angeles.
I also wanted a Black woman too. I wanted someone that can understand me, understand what I was going through, understand my body.
According to the CDC, Black women in the U.S. are nearly 3 times more likely to die from pregnancy complications than white women. Contributing factors include health inequities, mistreatment, and underlying chronic conditions. Doula Felicia Francis Edwards fights to improve those outcomes by advocating for families and providing physical, emotional, and informational support.
If I could tell you how many times women who signed up for the program said to me the reason they wanted to do the program because they thought they were going to die.
According to studies, mothers who use doulas are less likely to require a C-section or use pain medication, and their babies are less likely to have a low birth weight. But doula services can cost upwards of $5,000, and most aren't covered by insurance.
How do you think you would feel if you did not have your doula?
I don't want to think about that. I probably would feel a bit more lost for sure.
Bernun says now that she's found her doula, she's ready for delivery.
Black women also face health disparities with other conditions. Breast cancer, for example, is the leading cause of cancer death for Black women, who are 41% more likely to die than white women. The aggressive triple-negative breast cancer is more common in women under 40 who are Black or who have the BRCA1 mutation. The cancers are more likely to come back after treatment and have a poorer outlook than other breast cancers.
My mom passed away from breast cancer when I was 5 years old. I always had a feeling that either me or my sisters, one of us would end up with it, and it ended up being me.
New research, though, has found adding immunotherapy to chemotherapy treatments help get a better outcome. Early detection, though, they say, is key.
Sometimes you won't feel it. Go and get your mammograms.
Go and do it. Access and mistrust are some driving factors keeping Black Americans from quality health care. Some medical providers, though, are finding some unique ways to reach out.
Getting your hair done is an intricate process, hours of conversation and laughter. There's nothing quite like the community of sitting in a Black salon or barbershop. Everybody has a story, like Jewel Worrell.
I'm a former New Yorker and I grew up on pizza. So we like pizza, Chinese food, and bagels.
And she says she had no idea she had high blood pressure. That's until she met Dr. Terry Richardson right here in this salon chair.
She had me thinking about what I should do and how I should go forward and medically, and things that I should speak with my doctor about.
For the past 11 years, Richardson has helped Black communities tackle health issues, including mental health, through the Colorado Black Health Collaborative, giving basic checks and education to every person in the shop.
Clients really welcome us coming into their space. They really think that's a great thing, that people thought to come and meet them where they are.
We get physicians that come in, we get registered nurses and nurses that are experienced with blood pressure and with issues that are going on with our bodies.
Yeah, we've seen a lot of people that were in here and they ended up getting a screening while they were here, and they were almost like borderline stroke. So, it was just good that they were here just to receive that blessing at the time.
And she gives stylists and barbers tools to help their clients.
I helped her to understand a little bit of where her stress was coming from. And I did a breathing exercise with her, and I felt the relief and everything. She wasn't too keen on it, but she enjoyed it.
Richardson says the goal is empowerment, so customers can leave looking good and feeling good too.
You have so many people in the community that don't have health care, so it's a win-win for everybody.
Here in the Triad, the American Heart Association and Blue Cross Blue Shield partnered up to create a similar program. The Hair, Heart, and Health Barbershop and Beauty Salon Hypertension Initiative is in 16 different Triad businesses and is expanding to more.